Good afternoon or good morning, depending on where you are. My name is Joe Burns. I'm the Health Beat topic leader. I'm sorry, the Health Policy topic leader for AHCJ. And today's webinar is Follow the Money. It's the second in a series that we have with AHCJ and the investigative reporters and editors. This series has financial support from NIHCM, sorry. In this webinar today, we'll address how health insurers have used hidden clauses in contracts with pharmacy benefit managers and employee benefit consultants to drive up the costs employers, workers, and families pay for healthcare. Then we'll focus on how journalists can report on the hidden and lucrative alliances health insurers have with MultiPlan, a cost containment company for health insurers, and how those alliances drive up consumers' healthcare costs. And I want to point out that this topic is important because it affects how much self-insured employers pay for healthcare for their workers. The result is that when employers pay more, so too do American workers and their families. And keep in mind that half of all Americans get their health care from their employers. That's about 153 million Americans, about the same as are enrolled in Medicare and Medicaid. So employer-sponsored health care is a big part of the U.S. healthcare system, and about 55% of all employers are self-insured, meaning they assume all the financial risk of providing health insurance rather than having health insurers assume that risk. So that's the population of employers that we're focusing on today. There's another reason this topic is important is that just in the last week, the Rand Corporation reported that in 2022, employers and private insurers paid hospitals 250% more on average than what Medicare would have paid for the same services. Rand also showed that some states paid 300% above what Medicare would have paid, while other states paid under 200% of what Medicare would have paid. So there's a wide variety of payment policies nationwide. I can send that link. It's called the Rand Report is Prices Paid to Hospitals by Private Health Plans. The findings are from round 5 of an employer-led transparency initiative. So for our webinar today, that report makes 2 important points. One, employer-sponsored spending on healthcare comes from wages that employers would pay to workers and families. That means wages could be higher if healthcare costs were an important point to make in any stories that we do on rising healthcare costs. And because healthcare spending comes from wages and benefits, employers have a fiduciary responsibility to administer benefits in the interest of workers and their families. That fiduciary responsibility is enshrined in law, and employers' fiduciary responsibility to workers is at the heart of the reporting that Bob Herman has done for STAT, and that's Bob is with STAT News. Last year, he did a year-long investigation into the largely hidden flow of money from employers to health insurers, pharmacy benefit managers or PBMs, and to employee benefit consultants. That's mostly hidden. That mostly hidden flow of funds drove up healthcare and prescription drug costs for employers, workers, and their dependents. I can send you I'll put up the link that on the story we did about it. Bob also did a couple of really great stories. One in June last year, after a year-long investigation called "It's Beyond Unethical, Opaque Conflicts of Interest Permeate Prescription Drug Benefits." And then in February, he did a story about Johnson & Johnson, a lawsuit against Johnson & Johnson that asked, are employers liable if they overpay for drugs? So we'll begin with Bob talking about how journalists can uncover the hidden arrangements that drive up healthcare costs for employers, workers, and families, and how journalists can report on this important story. Then Chris Hamby, who's an investigative reporter for the New York Times, will explain how journalists can report on how MultiPlan and its health insurer clients use mostly hidden financial incentives to keep health insurers' costs down while shifting those costs to patients, forcing them to pay more than they would pay otherwise. So we'll put links up for Bob's stories and for Chris's stories. And so at this point, I'm going to turn it over to you, Bob, if you would begin laying it out, what's happening with these hidden clauses that we're talking about here.
Yeah, I think an important thing, just to reiterate, and you mentioned this at the start, is a lot of this involves self-insured employers. And that's important because that means you think about big companies, but even some smaller companies, it means that they're taking the risk of paying all of their claims for health and drug benefits for their employees and their dependents. So because of that, they are under what's called ERISA. That's a federal law governing um, all employers. They have to be good stewards of their health plan assets. And so because they're in charge of all this, they often it's a big responsibility. You know, if you're a company with tens of thousands of employees and you cover their family members too, you're spending hundreds of millions, if not billions of dollars every year on healthcare. It's a big task for any company, so oftentimes they rely on consultants to help them line things up with health insurers and PBMs, the pharmacy benefit managers. What makes this hard, and it makes it different from like governmental reporting, is this stuff is not easily, you can't do it under FOIA, really. Um, these are, private contracts between employers and, insurers or PBMs. It's not something you can just submit a request for and get. Now, there is a caveat to that. If you want to report on, for example, a county government, state government, obviously their employers themselves, you can FOIA for some of their contract documents. You can try, and some are actually posted online. So that's one workaround. But for the vast majority of America, it's private employers. So this requires you to really just build a lot of sourcing, which is a lot of it's how a lot of journalism is in general, right? It requires you to just talk to a lot of people, figure out who's in the know. And for my story on PBMs at least, a big component was just finding the benefits consultants that are independent, that are truly, they say, I don't take any fees. I try to steer the employers in the right direction. They kind of know where the bodies are buried to some degree. And if you find the right ones, you can start asking, okay, what do contracts look like? And some are willing to send them. Obviously, they're kind of risking a lot by doing so. But if you find the right people, they can help you out, get that hard documentation that you need. And then another great avenue for sourcing is attorneys. When these contracts are being developed between employers and either health insurers or PBMs, attorneys are going to get involved. It's just how it has to be done. The contracts are loaded with very dense and obtuse language. So attorneys who review these types of things also know kind of the language that might seem shifty. They might know trends about what is being inserted into contracts. So it's really kind of, at least to start, it's kind of just talking to people, understanding who's involved in these processes, that I think is a good way to start. And of course, ultimately there will be some breakdowns between employers and their health insurers or PBMs. So go running to the court system. That is where people take the time and effort to file their complaints and gripes and think that they're owed something because of it. So get familiar with Pacer. I'm sure Chris could talk more about that too with his story, but the court system and the legal filings are your friend.
Bob, can you talk a little bit about who those attorneys would be? Like, how do you find, you can, look them up? Are they employment law attorneys, maybe?
Yeah, exactly. They're the people that specialize in ERISA law, which again is that federal law that covers all employers and the fact that they have to be fiduciaries for all of their plan assets. So it's lawyers who specialize in ERISA or health benefits, any kind of subsector with that, and there's plenty across the country.
Uh, ERISA is the Employee Retirement Income Security Act of 1974. I put a link in the chat. And you also mentioned court cases. In Pacer, can you search by keywords, or what would you recommend once you get to Pacer?
Well, yeah, I mean, Pacer, you have to search for case numbers and everything, but there's also other helpful sites out there where you can search by keyword. One is Court Listener, that often houses a lot of cases out there, and is often linked directly to pay, so it can send you out to the actual case and the dockets. So I found that to be pretty helpful when looking for keywords instead of just having to rely on case numbers or parties who might have been suing.
It seems to be kind of a niche for reporters to report on some of the violations that employers have found in their contracts, that, in other words, ERISA violations. And I've seen that Bloomberg has done some really good reporting. John Tozzi over there, Sarah Hansard's another one. So I think if you look up their work, you'll find some sources there. Is that your experience too, Bob?
Yeah, I mean, I definitely Bloomberg's done great work on this as well. And there's also niche law firms and a ton of different groups and benefits consultants that have blogs out there. LinkedIn is another great resource where benefits consultants are very active talking about things that they've seen or grievances that they may have. That has been a great tap for sources as well.
Okay. I'm just going to make a point that if you have questions, please put them in the Q&A and not in the chat. I'll use the chat to put links up. But if you have questions, the best place for those is in the Q&A function. Bob, in February, you reported on the Johnson & Johnson lawsuit. That was the first one? Is that the only one that's come through where someone said, hey, my company is paying way too much for, and they had really good examples in that lawsuit, way too much for prescription drugs? Are there others that have been filed since then? Here we are in May, or do you envision others coming?
Yeah, the Johnson & Johnson one was, as many people put it, they called it the big one because, and a lot of people have compared a lot of what we're talking about today to some of the issues that have existed with pension plans in years past. And pension plans are also governed under ERISA. And the general contention is employers aren't doing a good enough job taking care of their employees and the assets that cover their care in this instance. So, the Johnson & Johnson lawsuit, the allegations there were, it came from a former employee who said we were overpaying for prescription drugs, and as a result, it led to lower wages, and it harmed the Johnson & Johnson employees writ large. There have been no other major lawsuits since then. The Johnson & Johnson lawsuit did cite our PBM investigation, and Johnson & Johnson has since filed a motion to dismiss. So we're still kind of waiting to see like a lot of legal cases, these things are going to take a long time. But I think one thing to watch is, will Johnson & Johnson start to will they start to throw some of their consultants and PBM under the bus? Because that's a main contention here is, as an employer, you say, okay, this is very complicated stuff. That's why we rely on consultants and PBMs to kind of help us out, make sure that we're getting good deals. And there's just too much faith in that process. And so we'll see if the tide starts to turn a little bit, if Johnson & Johnson starts to say like, well, hey, we relied on our consultant Aon and our PBM Express Scripts to figure this out and get us good deals, and they didn't. So it's the blame should be foisted on them. That's kind of like the next step that I think we should be watching for. But again, these cases are going to take a long time. It's not going to be resolved immediately, but and I think eventually there could be more to come if this lawsuit starts to show signs of progress for the plaintiffs.
Do you think it's possible that that journalists everywhere could reach out to consumers and say, hey, listen, do you think you're getting ripped off because you're paying way too much for certain drugs, or you're paying way too much for certain procedures, or I guess in this case it would be drugs, PBMs are involved. And if they compared what they pay to, let's say, a site like GoodRx, I don't know, I'm just pulling one out of the air, would they see like, wow, I'm paying X dollars every month for my medications, or my husband's medication, or my child's drugs, whatever, they're paying for, and it could be all three, versus what other sites say I should be paying. Would that be a good way to generate ideas for stories and sources who are aggrieved consumers?
Yeah, in fact, that's a kind of a central thesis of the Johnson and Johnson lawsuit. They actually say like, hey, for some of these drugs that we're paying $10,000 for, we can find on Mark Cuban's website for, $30.
Mm.
So that provides like the stark numbers that I think provide that kind of help tell the story of it, to make it a little bit more real, we're in terms of how people might be getting ripped off. And yeah, I think there's patient advocacy organizations that have those types of stories and can connect you with those types of patients. I mean, keep in mind this lawsuit was also started by someone who was familiar with health policy, at least within Johnson and Johnson. I think one of the problems or one of the hard parts about these stories is they're very complicated. Like most Americans just have no idea what a pharmacy benefit manager is in
Right,
general.
right.
So you have to be able to explain it in terms that everyone can relate to. It's kind of, they're the middlemen that help process your drug claims. But then it is finding those examples. And at least in the case of my story, it did rely more on the people involved in the negotiations and and the request for proposals with employers, as more of like a business story. But the patient stories kind of help bring a little bit more color, a little bit more anger to it, especially, and you can tell like from Chris's story in particular.
Yeah, there's a lot of anger. Once you start to scratch the surface a little bit, you find out, oh, people are really getting ripped off. There was also last year or the year before, a bill was proposed in Congress to reform the PBM business. I guess that's one word you could use. And there was some testimony in that there was some testimony by experts. In fact, there were some lawyers who testified. I'm going to see if I can find the uh, the lawyer who testified, because that case, that those presentations that they made to Congress, I think it was to the Senate last year, were really eye-opening, at least to me. So I'll dig those up and post them on the in the Q&A. I'm sorry, I'll post them in the chat. So how about employee benefit consultants? Is it possible that you mentioned when we talked the other day about how there are some who know where the bodies are buried? How do journalists find those people?
Yeah, I mean, it's the employee benefits community is surprisingly engaged. Oftentimes they come, like a lot of these people they're competing against larger brokerages that often tell employers to pick the large plans. You think, there's an acronym called BUCA, and that stands for Blue Cross, United, Cigna, Aetna, which is owned by CVS. Those are like the four big broader insurance companies that employers use for their employee benefits. And that is like a dirty word in the consulting circles, because they have to compete against other brokers who often choose, as they say, hey, choose those because they offer better rates with providers or they have better networks or whatever the case might be. So this consulting, there are a lot of independent consultants out there who really believe that what they're doing is they're trying to actually save employers money, but their voices get minimized at the negotiating table. It's harder to compete when it's just, maybe a single person shop. And there's plenty of ways to find them. There are conferences where employer benefits conferences where these people congregate and have ideas. Um, the community is very active on LinkedIn. You can find other social media, whether it's Reddit. There's blog posts. They are not afraid to publish stuff on what they think is wrong, and so those are just some of the different avenues. But it is a very active community that after you get talking to them for a little while, they turn to be very open and extremely helpful in explaining things.
Mhm. Right. So they know, as you said, they know the ins and outs of the business, and they know who tends to rip off employers and as a result consumers. So those would be some really good sources for them. Um, so So that explains it pretty well, I think, Chris. I'm sorry, Bob. Do you, Chris, do you want to, I'm trying to think of a segue that goes from what Bob is talking about to what to your thing, to your work. And the problem is that we're talking about hidden alliances or hidden contracts, that the stuff that's not public, that's happening behind the scenes with prescription drug benefit contracting with employers, but also behind the scenes with health insurers. And can you explain your work a little bit to help our listeners, our viewers understand what's happening with your reporting?
Sure. Yeah, these are another this is another sort of provision that's in a lot of these contracts that are generally not public. And I think both what Bob wrote about and what I wrote about are kind of fall within a larger universe of things that some of the consultants say are just common ripoff practices among the BUCAs, which everyone now knows what that is. That are not terribly clear to employers, or at least they don't fully appreciate what they're signing up for. And I think one dynamic it's important to understand is sort of the power imbalance here between the employers and the BUCAs, who are primarily administering these plans. There's not a ton of negotiating leverage, and I've been told by people that it's essentially it's not much of a negotiation, even with some very large employers. You have to be very sophisticated to negotiate a good contract. And, a lot of these people in HR at even big companies didn't get into it to run healthcare plans. They got into it to actually do work for, their organization. But this is a huge amount of money that their companies are spending. So, I think that's why we're seeing a lot more attention. The comparison with the sort of waste and excessive fees, the history from pension plans. I think that's, as Bob mentioned, that's a comparison I'm hearing a lot from consultants in the health plan space, that it's just sort of, whereas pensions are pretty well policed now because of, lawsuits years ago, health plans are really kind of a free-for-all, and there's all sorts of things that are in there that may drive up costs for employers and their employees. The part that I focused on was most claims are in network, which means that there's a contract between the provider and the insurance company, in this case the insurance company acting as an administrator of the employer plan.
Right.
For a set rate, they're not going to try and bill the employee for anything other than whatever their copay obligations are, but they're not going to bill them for the difference between whatever their insurance pays and the full billed charge, which is largely a fiction anyways. And so the trouble comes when you have out-of-network coverage, and the question then becomes, there's no contract in place there, so what is a fair price to pay the provider? And there's an interesting history here, and it's been a long time contentious issue. And there was actually a long-running lawsuit that led to an attorney general investigation in New York that ended up in a settlement in 2009. The allegations there were that a data subsidiary of United Health was basically operating a database that all of the insurance companies were using to determine out-of-network reimbursement rates for doctors, but that they were gaming the data to artificially suppress the payments. So when you do that, you leave potentially more of the balance as the patient's responsibility.
Right.
So they were required to fund the creation, and then for 5 years to use this new nonprofit that would gather data and make it available. And they had to use this to determine reimbursement rates. It was called Fair Health. But they only had to use it for 5 years. And after that provision in the settlement sunsetted, many of them started transitioning to using this other company called MultiPlan, which is now a publicly traded company. At the time was gone through a series of private equity buyouts as it was growing, moving from more traditional tools to a more analytics based, where they would allow, instead of negotiating with providers to try and reach some sort of resolution on a fair rate, they would simply run the claim through their algorithms and return a price. And these were often much lower, but again, potentially larger balance for the patient. The other
So
interesting
it's lower,
piece,
lower for the insurer. I'm sorry to interrupt, but it was lower for the insurer to pay the doctor. So the doctors or the providers, whoever they were, doctors or whatever they were, the hospital maybe, those people got lower payment and than they expected, and the insurers paid less than they normally would have paid, and the balance is then accrues to the consumer. So the consumer pays more. In other words, the consumers are getting shafted in this case. Do I understand that correctly?
yes, they're essentially slashing what they're paying the provider and saying either you take a pay cut or you try and collect from the patient.
I see. Right.
And these are self-funded. So in the context, this is primarily used in self-funded employer plans. So it's actually the employer potentially paying less, but where that becomes a bit murkier is the fact that they are paying for this service of getting a reduced price, and they are paying for that in the form of a fee to the insurance company, which then passes along some of that as another percentage-based fee to MultiPlan. And so this is it's based on a percentage of savings model, which means, so basically they will take the billed charge. So whatever the doctor's sort of list price is, which, as we mentioned before, no one ever pays. It's very high, usually, as anyone who's seen a medical bill will know. It's eye-popping. And then you take whatever MultiPlan recommends to pay, and the difference between those two numbers is what they call the savings. They then take a percentage of that amount as their fee. So you can see that as the difference grows, the fee gets larger as well. So you can see that they can grow that difference by depressing the amount that they pay. So the lower the payment, the bigger the fee, but then that delta becomes the responsibility potentially of the patient as well. So you have this interesting arrangement where the employer may or may not actually save money in the end after you add in the fee at the end.
Right. But then does the employer go to bat for the consumer in that case? I mean, couldn't the employer go to bat for the consumer, or does the consumer have any recourse, like the No Surprises Act? I realize that's two questions, but it seems to me that there should be someone helping consumers in this case, or representing consumers in these cases.
Yeah, so if in the last 2 years and going forward for certain claims, the No Surprises Act applies. That's mostly if you didn't go out of network by choice. If you were taken to an ER and you were treated there by an out of network doctor, or you went to have surgery at an in-network hospital, but they happen to use an out of network anesthesiologist, you're not going to get a bill for that. You cannot be balance billed for that. That's a whole separate process, but there's still, most of MultiPlan's business is elective out of network claims. So a lot of surgeries, behavioral health care. I mean, it kept coming up over and over again. A lot of people are seeing it with, therapy, psychiatry. And so, yes, there's potential recourse for the employee/patient, but it's pretty limited in a lot of cases. You could go through the appeals process with your insurer, and MultiPlan, that often, with the people I spoke to, was pretty fruitless, very time consuming. You can sue, but the damages are capped, and there's all sorts of barriers to bringing a lawsuit. You can file a complaint with the Federal Labor Department, which actually governs these self-funded plans. And that's an important piece of this, is that a lot of the patients I talked to tried to file complaints with state insurance regulators or attorneys general. And we're told they have no jurisdiction because it is a self-funded employer plan and ERISA preempts state regulation. So that's your option there. The other option that occasionally has worked, the only really way that any of the employees that I spoke with had any luck, was actually going to their HR department. And explaining the situation. And I think in a number of cases, so there was kind of a split between HR essentially deferring to the insurance company administering the plan, because again, it's very complicated. The insurance company says that this is a fair payment determined by this independent third party that everybody uses and trusts, then they're just going to defer to them. In a few cases, they have adjusted, the employer has, as they have the right to do, direct the insurance company to pay more on the claim to alleviate the patient's burden, because it's their money. They're the employer.
Yeah, it's the employer's money. Right, exactly. And that seems to me a logical way for employees and for workers to get get some redress, is to go back to the HR department. But as I think we mentioned earlier, the HR people may not be fully aware of what's happening. Did you? I know, Bob, have you seen that? And Chris, have you seen that as well?
Definitely. Yeah, and I'll let Bob go ahead, because I'm
Yeah, no, I mean, Chris is 100% right. Like the people that go to HR and say something, I've seen and heard and spoke with people who've done that, and it does. I mean, employers don't want their workers and their families to be pissed off, and so,
Right.
and especially if like these cases that we're talking about are pretty egregious, right? Like if someone like has an ambulance bill and they are on the hook for $5,000, like that just seems ludicrous because they didn't choose that. So oftentimes HR will, I mean, it's not to say it's an absolute, but oftentimes it's a great way to get eyes on it. But again, like, at least, HR is kind of overmatched with some of this stuff, at least on the back end when they're negotiating this stuff. That's why they rely on consultants to do a lot of this. And so oftentimes these situations arise, these patients getting these large bills because benefits teams just kind of default to deals with insurers and vendors that ultimately aren't that good of deals anyway. So
They
I'll say
default
also
to.
some of the,
Oh,
I
go
was
ahead.
just going
Go
to add
ahead,
one other
Chris.
thing, is that one reason is that people might not go to HR, and this was something that a few patients actually told me, is that they didn't want to complain to HR. They were worried about their job security. So yeah, that's another obstacle. And then, HR just tends to be pretty deferential to their benefits advisors and insurance companies that administer their plan.
Right. And you made the point, Bob, in your stories that that employee benefits consultants were getting a fee based on advising the employers to use certain PBMs. That seems to me like they're double dealing. Is that the word? Is that the appropriate term?
yeah, I mean, that was kind of the thrust of my story. The fact, like when an employer hires a benefit consultant for anything, whether it's the health plan stuff that Chris is talking about or the drug side, there's the understanding that you consultants are working on for me, the employer. And when the consultant, nudges the employer to choose PBM deals or insurance deals that are loaded with terms and contracts that inflate profitability for the insurer, for the PBM, the consultant is not doing that. And what the employer doesn't realize is sometimes there is a flow of money between the PBM and the consultant, at least in my stories, which completely ruins the impartiality of the consultant. If the consultant is getting money from someone they're supposed to be judging and evaluating, do you really think they're going to be pushing that hard on the best stuff? Probably not, because they know that they're getting revenue there. And that's just something that a lot of employers aren't aware of. They just assume that their consultants, their broker, a lot of which they've had relationships for like a long time, a decade or longer. There's a trust factor there where they're like, certainly our broker wouldn't screw us over. But that is just, that's a lot of faith in the process. I mean, these fees between PBMs and consultants, at least in my case, it's a thing, it's happening. It's not like it's made up. And it, like to your point, Joe, it just, it undermines how impartial that the consultant can be. And ultimately it affects the employees, the employer, how much the employer is paying. And then to the start of the webinar, how much someone's paycheck is.
Right. You get And the same thing is happening, Chris, with employers working with MultiPlan. MultiPlan and its insurer clients are working together to serve each other, right? They're not working together to serve consumers. So again, consumers get aren't well served.
I mean, that certainly can be, that is one allegation here, that some ERISA attorneys have floated, is that, this is something that the Labor Department is aware of, is that there's a potential conflict of interest there in which the insurance company and MultiPlan are acting in ways that are financially beneficial for themselves, but that are adverse to the interests of the plan members, i.e., bigger fees for themselves, bigger bills for the patients potentially.
Right.
And I just wanted to flag one other thing about all of this that I think cuts across both what I think what Bob has reported on and what I did as well, is that all of these things, paying these fees or these sorts of arrangements that are in these contracts, is really, I think, typically pitched by insurance companies and brokers and all sorts of vendors as industry standard. And they're sort of saying everybody does it, as if that is a justification for doing it. And so I would suggest to people maybe that if you get someone telling you that everything's fine because it's an industry standard practice, that is an area that you might want to look into more. And I think there are a lot of other things like what Bob and I wrote about that are in a lot of these contracts. And I mean, interestingly, after the story came out, I mean, the mere fact that United Healthcare and Cigna both described it as industry standard to me in their comments was something that was picked up on by Senator Amy Klobuchar as anti-competitive potentially, when she requested an investigation into this by antitrust regulators. I mean, her concern is that it could be price fixing. So,
Right.
I mean, yeah, there's a lot to look into here.
Well, I'll say, Bob, we have a question from Millie Dawson. She asked she commented that you mentioned PBMs who don't take fees. If they refuse to take fees, how do they get paid?
Yeah, it's a good question. PBMs get paid in a host of different ways. And when an employer sends out a request for proposals, when they start to choose their PBM, the PBMs offer in a range of different ways that they will get paid. Oftentimes they say they will keep a portion of rebates, which is, it's the traditional way that PBMs have been paid. And a rebate is it's a discount that gets chopped off of kind of the list price of the drug. And, hypothetically, most of those rebates are supposed to go back to the employer. The PBM gets its beak wet and keeps some of it for itself. Now, the PBMs who, at least in my story, who said that they don't take those types of fees that we're talking about between consultants and the PBMs, there's no fees there. They get paid just for their services, like a traditional claims processor. They say, we're going to charge a certain amount per member per month. And that's all we're doing. We're not taking anything from the PBM at all. We're still getting paid for our services because we're processing claims and we're making sure you're getting good discounts on your drugs. But there's no extra fees there. And some PBMs will make that explicit. They say, we accept no other fees. While some of the other PBMs and consultants would be a little bit dodgier. They say, maybe we don't accept fees for certain services. But for those PBMs that say we don't take fees, that's in regards, we're just saying we get paid for our services, but it's per member per month. And there's nothing else on the side.
Okay, that makes sense to me. Chris, we have a question from Andrew Sprung. He said, how often do self-funded employers undertake to pay any part of an out-of-network bill? I would have thought that these days most don't pay anything for eyes wide open out-of-network care, but how does it work?
Well, I think if you look at the numbers, I mean, a lot of employers offer PPO plans or plans that offer some out-of-network coverage because employees want that, and that's a competitive, that's a way to make your medical benefits look more competitive. And then, at the same time, from the employee's perspective, I mean, they're paying higher premiums for these plans with the expectation that they're going to have coverage. for out-of-network care. I spoke with people who, for instance, a woman whose son was battling opioid addiction, and so elected for a PPO plan because she wanted to have decent out-of-network coverage to defray some of the costs should he need treatment. But then when he actually did need treatment, that coverage was a lot less than what she expected. That's something I heard from a number of patients, patients with Crohn's disease who needed to see an out-of-network specialist. He got sent to MultiPlan and he got a lot less than he anticipated. So, there's sort of people like having out-of-network benefits in these plans, and they pay more for it.
Yeah, right, exactly. I have a question about non-group plans. In other words, if someone's signing up on the ACA marketplaces, they can get help from health insurance navigators. I don't know if they can get help after they sign up, but maybe they can, because those people would be impartial and would consult on different health plan options. And the question is there an equivalent type of broker or consultant for employers to get access to information on what plan to choose from an impartial source that doesn't profit as a result of the consumer making a choice that would benefit the broker or benefit the insurer over the consumer?
It's tough, at least for just to be clear, for non-group plans, those are what's considered fully insured, which means that the insurance company takes on the full risk of paying out medical claims. You could be in a small employer or, just like you said, individual covered yourself. It's a completely different insurance plan. It is governed by state insurance departments then. It's not governed by ERISA. So, the brokers there, and there's been stories written about this over the years too. The brokers there sometimes might steer people toward plans where maybe they get higher commissions on the back end from insurance companies. So there's still potential misdeeds behind the scenes. Employers can still find independent benefits brokers. Some have even cast aside, like some of the big brokerage houses, to do what's called direct contracting, or just choose a different health plan where they don't have to go through a large consulting firm to weigh down their options, or go through a large group purchasing alliance. Those are rare, admittedly, and but those groups do exist, but it is not the norm, I would say.
But somebody else asked a question about direct contracting, and that's an interesting way around this. It seems to me it's an interesting way around this problem, but it requires real sophistication on the part of the employer or the health planner who's ever doing the direct contracting, because you have to work directly with a hospital or a hospital provider or a hospital network, and that hospital has to be big enough to serve all your employees, or else you're going to fly them like to the Cleveland Clinic or to Mayo or someplace. But some employers have had success with that. Is that right?
Yeah, I would say to varying degrees. I know in California, there's been some employers that have said we're going to do direct contracting for certain services, especially elective procedures. Obviously, for all care, it's not going to work. And some of the care that Chris is talking about, the out-of-network stuff, it's you can't direct contract for everything. But in certain instances, yeah, direct contracting has worked, especially for those where you find the high quality providers that offer a pretty good, reasonable price. You can do piecemeal like that, and some employers have shown that's worked, but it is not overwhelmingly. It is not the way that most employers operate in terms of offering coverage.
Yeah. Okay. I had a question that was for both of you. Andrew Sprung said maybe 20 years ago there was a big scandal over property casualty insurance brokers getting kickbacks for steering their clients to particular insurers. Is that analogous in any way to what you're reporting on, Bob, or is it similar to what's happening with MultiPlan, Chris? Guess we'll start with you, Bob.
Yeah, it does. There, at one point, there a lot of these, and this was I wrote about this in my story. There were these types of the fees between brokers and insurance companies were outlawed. They were considered kickbacks. That eventually lapsed, and the payments started to continue again. But it's the same type of setup where, a broker who's supposed to be impartial, taking money to steer people toward a certain plan. Obviously, there's inherent conflicts of interest there. But yeah, I think that's pretty analogous, because it was a thing, and it kind of came back into Chris's point too on the out of network stuff. They had to use Fair Health for so long, and then that lapsed, and now they're kind of just reverting back to something that used to happen all the time. So yeah, I would definitely say those are there are parallels there.
Yeah.
And yeah,
Chris,
I would.
can you, oh, go ahead. I'm sorry, I cut you off. You were going
Yeah,
to
it's a little bit
answer that
different, but
question
there
as
is
well.
kind of a similar, somewhat arrangement with the insurers and the use of MultiPlan, in that they sort of moved from the system in which they did not get fees to a system where they did get fees. So, they will generally pitch MultiPlan services to employers as a way to save money, contain costs, and protect your employees. The previous option for that, Fair Health, the insurance companies would pay them a licensing fee. They would get the data for the year, and however much they use it, they still pay that same amount. And they do not charge their employer clients a fee generally for using that data, because there's no need to. But now they're saying they sort of, using MultiPlan, created a justification to charge a fee, because you have to send it to a vendor, and that requires all these, sort of IT and HIPAA compliance issues, and they can sort of justify charging 30 to 35% of the, quote unquote savings, as their fee. And then, this became a pretty significant revenue stream for them, to the tune of, almost $1 billion a year for United Healthcare, according to some court testimony.
So how do you find stories? One, we talked about reaching out to lawyers, reaching out to benefit consultants, asking consumers to send in their horror stories to you, or to, and journalists anywhere could do that, right? I mean, if you were in New York State, you're covering, I don't know, the city of Albany, or you're covering Schenectady or Rochester or Buffalo, you could ask your readers or your listeners to send in horror stories, and maybe you'd get some good ones over time, no matter where you are, right? Is that so? Those are all ways you could do it, but also, could you reach out to patient advocates? Patient advocates must hear horror stories all the time, and if you made friends with them, or enough of them, you might get you might find a good source there. What do you think? I'll start with you, Bob.
Yeah, I think the patient advocacy groups are often organized around these things. They receive medical bill stories from patients. They are a great resource, and they're often open to working. One other thing I think is worth mentioning, going back to the employers, and that's a great way to localize this story, is going to both small and big employers in your area and seeing what problems they're having, especially if this is, it helps if they're self-insured, right? That means that they're the ones who are having to pay everything out of their own pockets. But see if they're open to talking. The problem is, a lot aren't, because some see it as almost embarrassing in a way, because if they don't want to talk about getting ripped off, right? That makes some employers look bad at their jobs, which again, sometimes the deck is stacked up against them. They're going up against companies that this is kind of what they do. So one way around that is there's employer groups, employer coalitions that often keep tabs on these types of trends. They're another great resource to go to. And they often can find employers who are willing to talk, who are a little bit more outspoken about stuff that they've seen.
That's a good point, employer coalitions. And I ran into that problem with a regional airline here. The head of the regional airline was reported as saying to some national outlet that he was in favor of the Affordable Care Act. So I called there, and they said, no, we don't want to talk to you. We don't want to talk about that anymore. I guess he got some pushback from somebody. Chris, what do you think about patient advocates?
Yeah, they can be quite helpful sometimes. I would also say, when you get to these people, ask for primary documents, because in the number of cases that I mean, this stuff is all really complicated, and especially if you're looking at a very specific thing. Some patient advocates that I spoke to didn't really even fully realize how these sort of pricing arrangements worked in some cases, but it was in the documents that they had access to. So I kind of talked to them and got a sense of what they were dealing with maybe, and got suspicious that there was something more there. And then they sent the primary documents, and you look into that. Another thing that I would suggest potentially, this is not necessarily a starting point, but if you want to get more information after you kind of have something to go on, is this was my first foray really into trying to get documents unsealed in litigation. And we actually decided on a relatively low intensity, low touch approach that we thought was going to be more efficient time-wise and resource-wise, that wouldn't require us to have a lawyer get admitted in these different jurisdictions. So I actually just wrote a letter to the judge in 3 different cases expressing the public interest in disclosure of some sealed documents, and sort of making an argument both from a legal and a public interest, fact-specific kind of standpoint. And, you know, we, in a relatively short period of time, and I'm talking months here, but, you know, in one case got a lot of useful information unsealed. So that was, you know, a pleasant surprise.
That's great to hear. But not all judges are going to be open to that, right? Because they're probably going to ask the parties involved, and the parties are going to say, "Oh no, we don't want to unseal any of this stuff. We're keeping it sealed because that's in their best interest." Is that what you found typically?
Yeah, for sure. And that is almost more of the default. But we, you know, this is why maybe some evidence gathering up front can also be helpful. I mean, you know, it does require an investment of time to figure out what's sealed, and you know, craft an argument for why it should be unsealed, but also, you know, sort of knowing your audience a little bit, in that the judge that ended up, you know, giving a ruling that was, you know, unsealed a lot of documents, was one who we suspected might do so because he seemed to have a real interest in public disclosure of court records. And, you know, certainly that's not necessarily the norm in all court cases.
No, not necessarily the norm, but it would be great if it were. I mean, the court cases are public. And yeah, I understand that some parties want to keep some records sealed, but healthcare affects everyone, and if all of these practices are driving up costs, it would be nice to see that more public records. Are there other sources for public records outside of courts?
Well, I think I mentioned at the top, you know, what's hard with a lot of these cases is they're private contracts between a private, you know, multiple private employers. But the one workaround, if you want to try to start FOIAing some of these documents, is if, for example, you want to look at the contracts for a state or county government, local governments, school boards. Those are all public entities, so depending on your state, they should be subject to open records law. And that, I mean, that is one way that in the past I've gotten records, others have gotten records that way too, is finding the public employers, because in an area where most of this is hidden behind a veil, that's the one chance that you can kind of wiggle your way in. Unless
That's
you're
a really good point,
very
Bob.
good at letter writing. So
I'm sorry,
And
can you say that again about being good at letter writing?
yeah, I said that's your one way to get in, unless you're Chris and you're very persuasive to judges out there. So
Right,
I don't know how
right, but that's public funds. And were you going to say something, Chris?
Yeah, and I think just one other thing would be publicly traded companies. SEC filings are great, and even if it's not necessarily a publicly traded company, I love earnings calls, investor presentation transcripts, and just going to these conferences, because companies are often a bit more candid about how their business works.
yeah,
Right.
I want to echo that too. You know, they are often very honest with their shareholders and traders. That's honestly that's their main audience. And to echo the SEC forms, there's one particular form, it's called the annual report, the 10K. That's often where all kinds of good nuggets can be buried. You know, in one case for my story, that is where some of the consulting firms said, like, oh, we're kind of worried that maybe some payments to brokers could violate anti-bribery and kickback laws overseas. So like that's a good way to understand how companies, even their legal teams, are thinking, like, okay, we know that we have to start disclosing some of this stuff. So I highly recommend the looking at SEC filings of publicly traded companies.
And scroll to
That's
the
a
end and look
very-
at the exhibits.
Oh, really?
Hmm.
the annual report and then look at the exhibits at the end. Is that your recommendation? Uh-huh.
Absolutely. Yep.
So Bob, you made a really good point a minute ago about public companies, about public entities, school boards, the state of every state has employees all over the place, right? They're cutting grass, they're building bridges, they're maintaining bridges, they're doing, they're all over, and they have huge employee contracts. And those are all public funds. And every state wants to manage those funds carefully. And anyone who's a taxpayer is going to be very interested in, how's the state, contracting with health insurers or with PBMs or with employee benefit firms. And of course, there's 50 states, but there's also, in the state of New York, there's big cities everywhere. In the state of California, the same thing. And in Texas, in Florida, all those cities are public entities. And some of those entities are very concerned about how much they're paying. And so are the taxpayers in all those places. So if you're in a state or in a city or in a town even, and your school board is contracting with health insurers, which of course they are, then that's a good source right there. I think that's the point you were making, right?
That's right. Yeah. It's worth trying, FOIAing those different entities. I think a caveat that I've encountered is oftentimes you might run into redactions, especially if information you really want to see. So again, it could be helpful, it could be great. Other times it might not be. And that's again why it's helpful to, work sources within the industry who might have documents and are willing to provide them to you, the unvarnished, like true documents. Again, they're at great risk when they do that kind of stuff. So, be open to getting stuff mailed to you, or it's especially hard having a digital fingerprint on some of these contracts. But yes, it's great to have those public entities and FOIAing them, but it's even better to have stuff that's completely unredacted.
Right. Also, we have 2.5 or 3 minutes left. Do you have any closing remarks that you want to share with us, Chris?
I think so, other than a plea to continue looking in this space, because I think that what Bob and I wrote about is really only the surface of all the things that are potentially of great interest to readers in this health plan space.
Oh, absolutely. Bob, do you have any closing remarks you want to wrap up with?
Yeah, there's so many stories out there. It's I know it sounds like complex and boring to get into this, but there's a lot of money here. It affects literally all of us. We all, many people get insurance through your employer. And I think there's so many like other business stories that are untapped. And like, for example, I'm interested, like if employers are actually decide to fire a consultant or fire an insurance administrator, like to me, that's like a headline story, like, X company fires Blue Cross. Like those types of changes don't happen frequently, but they do happen. And so I think more of that should be reported as well.
That's a really good point. How do you find out about that stuff?
Again, it's getting people to talk to you and then confirming it through either documentation, but a lot of it requires people in the know who are like, yes, this is happening. So those stories are a little bit harder to get, but when they do, I think they're newsworthy.
Yeah, I would think. Go ahead, Chris.
In one county in Florida, they actually terminated Cigna after a number of years, and Cigna sued them. So that's one way to figure it out.
You can't get rid of us. We're gonna sue you. Even though we're not helping you out at all, we're not going to take this lightly. Yeah, that's a story. Well, thank you very much, gentlemen. This is a very, very enlightening webinar. I appreciate your time today and in the past few days getting ready for this. I will post some links to your stories, Chris, and to your stories, Bob. And if would you say if people reach out to you, would you be able to send them some of the stories that you've done, Chris, that are not behind the New York Times paywall, or how does that work?
Yeah, it may be kind of a clunky looking PDF, but yes.
Okay. And Bob, what do you think about that?
Yeah, absolutely.
Okay, clunky PDFs is the way to go. Thank you very much. Appreciate your time today. This has been great.
Thanks so much.